All right, good morning. Good afternoon.
Good morning, Carly.
How are you, Jocelyn?
I'm doing well, thank you.
And what are we doing here today?
Well, we're going to talk about Invisalign.
Let's do it. Our first podcast ever. We are from Fielding Dental in Burlington, family-owned dental practice. You're a hygienist. You have your patients showing up, all ages, babies. I mean, we have people doing Invisalign who are in their 80s. And why do you love straightening their teeth?
Well, because we see adults when they get to that stage where everything starts to really drift forward and we get a lot of that anterior crowding.
What are you talking
that's the
about,
front.
drifting forward?
So it's called the mesial drift. So as we get older, our teeth naturally will start to drift forward.
Right.
So the lower front and the upper front teeth, I'm like, where am I going with that? They start to drift forward.
Yep.
And they will start to crowd.
Right.
So when we're younger, we might have a little bit of crowding.
Yeah.
And then as we start to age, we'll see more and more crowding. So really you want to get your teeth into a position that they are side by side, stable.
Yeah.
They kind of hold on to each other. Then you have these other factors that keep them in place as well. Your lips, your cheeks, your tongue, just keep them all aligned. Because when you're older, it's so much easier to keep those little nooks and crannies clean.
Okay, so you want to line the teeth up because
Yeah.
you're saying that when they're crooked,
Yes.
like I'm not a hygienist or a dentist, so
Yes.
I'm going to just say it how normal people talk.
Okay.
When your teeth are not lined up nicely back to back
Yes.
and they're kind of starting to
Yes.
get in front or behind, they're going to want to just keep going more forward. So
Yes.
basically, somebody like myself, I've got a little bit of crowding starting. It's just going to get worse.
Yes.
So I get that. You want to have your teeth lined up. But the reality is Invisalign is not just for a good-looking smile.
No.
It's also to keep your teeth healthy and help you clean them in a more easy fashion.
Yes, there's that. So we talked about the crowding. There's also the occlusion. So that's how your teeth, the forces go together.
Right.
So
A lot of times parents will ask me, like, my kids' teeth look pretty decent. Why would I do any version of Invisalign or braces? And
yeah, they look good.
when you look at the smile, I see their point, like things are somewhat lined up. But then knowing what you guys are teaching me, if those two teeth at the front aren't like lining up nicely and occlusion or touching each other in the perfect spot, there's like a gap in there, whether the top's over the bottom or the bottom's over the top and the back teeth, that's going to give you problems with your biting, right?
Yeah.
Which is just going to get worse as your child or whoever, even in your 40s, it's going to get worse as you get older.
yeah, so we call that a malocclusion. And
Right.
the amazing thing about that is we can now do a simple scan within 2 minutes and we can assess the bite.
Right.
So we can see all those things that you can't really see with the naked eye when you're staring straight on and someone's just smiling. A lot of
Right.
times you can't see the back teeth. But ideally, you want to have cusp to cusp. You want to have perfect bite. Well, not cusp to cusp, but you want to have your teeth go together in perfect formation so that you don't have any wearing of the surfaces that aren't as strong. You want
And
it to
basically
always be
wearing's
on
going
the
to
strong.
happen because things are tapping and crashing where they're not supposed to.
And you get
So-
micro cracks as you get older. You
Right.
get just wear patterns that ultimately is going to shorten your teeth.
Right. So that's kind of part of the point here is that Invisalign is always something to consider. But also pricing is something that people generally will get a little bit shocked sticker price on when you're talking to them about Invisalign or braces because it is going to be a higher price point. But the reality is if you look at that investment and you see what it's going to gain you in the future, it's going to help prevent those teeth getting chipped, broken, cracked, and needing crowns. It's going to prevent your buildup of
Bad
bacteria and gum
calculus.
recession, which could lead to things like gum grafting. I mean, these are extreme situations, but that is the end goal, is to get everything lined up and cleaned nicely so that we can not have to fix cracked, broken, worn down teeth and keep as much of your healthy structure as we can.
Yeah. And that's the amazing thing with Invisalign. They make it super simple.
Yeah, I find it interesting when people come in and they're asking for veneers or crowns. And then they're a little caught off guard when we jump to, well, let's line the teeth up first because
You want to preserve your investment, basically.
exactly, we put those veneers or those crowns on without lining that bite up nicely, then there's a potential that you could break them more easily and shorten the lifespan of those items.
Yep. So should we get into the nitty gritty of how Invisalign works, how we do it at our office?
Sure, let's do it.
Okay.
So I'm coming in, I'm going to
Yeah.
get Invisalign. What's going to happen? How are you going to show me what's going to happen?
Well, what's so amazing at Fielding Dental is that
Oh, you're very cheesy, but continue.
we do a no charge free consultation to assess your bite,
Right.
to look at all those things that we just discussed. So
Yeah.
the crowding, the occlusion.
And to play with and show off our iTero machine.
Yeah. Show our great technology.
Right. So what are we going to do with that?
So
We're going to come in.
you're
We're going to
gonna
have our
come
complimentary
in.
consultation.
Yeah.
You're going to scout my mouth
we're gonna
and show me.
We're going to take some photos.
Yeah.
And we're going to show you basically, and the technology is so amazing nowadays that you can actually show with your face what your teeth would look like, what your smile would look like
Right.
if you were to have Invisalign, if you were to realign your teeth.
Yeah, I love that. So people can come in, they can see the before and after right there on the screen, just from us doing that digital scan and then rendering what the outcome would be, which is great because that's part of like you're deciding to spend all this money. Why?
Yeah.
So I think those consults are great because it really gives them the why.
Yeah.
And there's a lot of things that somebody might be unhappy with their teeth or, not loving, but they don't necessarily want to bring it up and don't think that they can have a smile that they would love. But then when you show them the difference that can be made when you line everything up and how much bigger that smile can look,
Yeah.
it's amazing how quickly people run to get their Invisalign started.
Oh, yeah. And the nice thing, too, is that it's very quick to get started.
Yes.
As soon as you say go, within
Yeah.
2 weeks, we can get you in the office.
Yeah.
It's a quick appointment just to get everything set up. We have to put
Yeah.
a couple glue spots on your teeth just to help with
Right.
the trays.
Okay, glue
And then-
spots.
Yeah.
Maybe you need to talk about that.
Okay, all right.
So how do you move teeth with Invisalign? Like, first of all, we all know, I think at this point, the whole world knows that it's clear aligners, kind of like
Trays.
retainers that you wear.
Very, very thin.
Yeah.
Very hard to see on your teeth. It might make your teeth a little bit more shiny, which
When
looks
you
clean.
first start wearing them, you do have a little bit of a lisp because
Yeah.
there's just what is it, a millimeter? Or how thick are those aligners?
Yeah, I would say by the time you get, once you have your upper and lower aligner on, then you'd have a little bit of a space in between your
So you got
natural
to get
bite.
used to speaking clearly with them.
yeah.
But you're going to put
You come in.
attachments on.
Yeah, it's a quick appointment. We clean the teeth very simply, not a whole cleaning appointment, but we just prepare them to put like a glue material on. They are specifically shaped by Invisalign to rotate, change the positioning of the tooth.
Okay, sorry, you lost me
gradually.
there.
Okay.
What's specifically shaped by Invisalign?
The glue. The little glue
Attachments?
spots, the attachments.
Okay, I think attachments is going to be more understanding. The attachment is
attachment
made of a composite
is-
material, just like a filling.
Yes, exactly.
Easily removed
but
at the
it's
end of the day.
temporarily attached to your teeth.
And there's no damage to the teeth with
No.
removal. How do you know this?
We know this because this is what we're trained to do.
Right, but
We
how do you
can
know when you're
see-
removing it that you're not going to damage
Because
the
we
enamel?
can see the glue.
Okay,
We can see the attachment, sorry. We can see the attachment. When I'm
Right.
talking to kids, usually they're like, what attachment? What are you talking about?
yeah,
So I usually try to say that little white spot that we put on that has like a little bump on it.
yeah.
When we are removing that from your tooth, we just gently go over it with a burr and it will
Right.
only remove the glue spot, the attachment.
Okay,
Yeah, I'm going to have a really hard time saying attachment.
yeah, well, continue. Glue sounds weird.
So, okay, so you come in. We have from Invisalign your pre-shaped trays, your
Yeah.
aligners. They have the little bumps on them.
Yeah.
Once we've prepped your teeth, then we put the resin, so that is the cement or the attachment or the glue.
Oh, great, we found a new word. So it's not attachment anymore, it's resin. Let's go with attachment.
So we'll put the attachments into the tray, which will be
That are custom designed.
that are custom
to
designed.
move people's teeth
Yeah,
where
it's
they
pretty
need them
amazing.
to move. So
Yep.
basically, if it's going sideways, upwards, like
Yeah.
whatever we're trying to accomplish,
Yep. They'll
they're
know
gonna
the
send
end.
us.
They'll know the end goal.
Yes.
And then we'll have certain aligners for each week. And every week, once you put a new aligner in, it'll shift that attachment into the position that it needs to do for that week to
Right.
get to your end position.
Right.
So it's pretty cool.
Yeah.
So we get the attachment glued onto your teeth, cemented onto your teeth, and then you're all set to go.
Right.
It's
you just
that
have those
simple.
retainers. I know it does make a big difference. I think we were finding a lot. I get it. Like a lot of parents like the idea of braces, and absolutely for some people, it is
Well, you
the
set them and
right
forget them.
answer. But I do think that most of our feedback from patients has led us to going full with Invisalign because we now know we can accomplish anything that we're trying to do with braces. But the Invisalign is a lot more convenient. It prevents, we were finding with some of our patients that there was more of those nooks and crannies, for lack of a better word, like you were saying, can hide spots where bacteria, plaque builds up, and they really have a very challenging time getting in and around the brackets. Invisalign will eliminate that. The main thing is keeping those aligners clean, right? So why don't we talk a little bit about taking care of the aligners? I mean, the reality is you have an aligner for a week to 2 weeks max, right? So we have had some people who have come in.
Sorry, I've had a hard time. I can't really jump in when you just keep talking.
Well, I was just leading to a question, but you go ahead.
Well, should we talk at all, because we went by it, but should we talk at all about the difference with the band and bracket that people like because you set and forget them, but you can't remove them to clean your teeth. So if you
That's
get
what
that
I just said in my own way, but that was a way simpler. So one more time, set and forget. I mean, they do think it's set and forget.
Yeah,
but it is
well,
not
that's the
set and
problem.
forget. It's set and forget and call us 10 minutes later and be like, the wire is poking my cheek.
Yeah.
Or things
bracket
shift,
has
the wire
popped
got
off.
longer. I had popcorn. The apple pulled my bracket off. The whole wire's out. This snapped. This broke. And typically,
it's usually parents that are calling and they're saying, my child's calling from school saying they hurt. They don't know where it hurts. I need to get them in right away.
Yeah.
God
so
forbid, it's on the
feels
weekend.
like set and forget, but those kind of things happen at the most inconvenient times. And it really sucks when they're trying to get us on the weekend and we're not open.
Yeah.
Because that's a trickier thing to maneuver. Whereas if you've got Invisalign, you can take the
them
aligners out, wait, and find us on Monday.
Yeah, or just keep wearing them if you've lost an attachment.
Yeah.
Really, it just means one popped off. Keep wearing your aligners, and we'll get you in when it's convenient for you.
Yeah.
And we'll get that attachment back on.
Right, because you can keep wearing them comfortably when the attachment comes off.
Yeah, so that is huge.
But are people actually going to wear their aligners? That's the question, and I think that's the number one reason why they're hesitant. Like you just said, braces for kids, set and forget is the impression people get. But a lot of times I think people know themselves and they're worried that they're not going to wear the aligners. What do you find with your patients, or how do you find people? Are they successful? Are they not successful?
Yeah. Well, the nice thing with Invisalign, especially the teen cases, is they have identifiers on the tray. So we can know by this color whether or not your child is wearing the aligners enough.
Right.
So they could say, I'm wearing them all the time, but then they come in and this blue dot on the aligner is like fully still there.
Right.
Then we know really they haven't been wearing them.
Yeah,
And
I
then,
love that you're immediately going to the place where we're checking on the child.
Yes.
Because that wasn't what I was thinking. I was more like if somebody's considering even doing Invisalign for themselves. And they're like, I'm not going to wear these things. What would you say to that person?
If someone's like, I'm not going to wear the aligners, it's kind of like a night guard. If someone says, you know, you can prescribe me a night guard, I'll buy the night guard, but I'm not going to wear the night guard.
Right.
Then we'll, of course, say every time they come in, we'll assess their bite and we'll check those wear patterns. We'll reiterate the importance of wearing the guard. But if they're not going to wear it, then that is a problem.
Right.
That is the one weakness with Invisalign. If you're not going to wear the trays and you know you're not going to wear the trays, even though you know you've all these benefits of wearing the trays.
Right. Well, I just find people say that all the time.
That they're not going to wear their trays?
Well, they say, like, my number one concern was that I wasn't going to cooperate and wear the trays. But they actually find that Invisalign is way less intrusive in their life than they thought it was going to be. You can take it out if you have a special event. You can take it out if you're eating. You can snap it back in. Essentially, if you're having a really bad day and you're over the whole world, you can take them out and take a break.
Take a break, yeah.
If even sometimes I find life gets slammed and you've lost your retainers or aligners and you did not have time to get back in and get started again, then the nice thing about Invisalign is that we'll just restart you where you are. We'll take a scan where we got to and restart. And by restart, I don't mean go back to the beginning. Start with a new set of trays.
Plan.
Yeah, revise the treatment plan. So that to me is also really nice, that if life does creep up on you and you actually are like, I need a break for a moment.
Yeah.
You can take a break and get started again with a new set of revised liners when you're ready.
Yeah. Invisalign does allow for, I believe they still do, a 5-year trajectory for your treatment plan.
Right.
So like you're saying, if all of a sudden something changes in your lifestyle and you're like, right now, I tried it, I can't really do it right now, but I want to get going again in a year or 6 months, then you can do like you're saying, take a quick break,
Yeah.
revise the treatment plan at that point when you're ready to restart, and then
Yeah.
try it again.
Yeah. And then I think we're trying to teach them a positive habit, and we keep them accountable by having them come, what it depends on the person and what
Like
they're
every 6
accomplishing
weeks
every
or
6
so.
to 8 weeks to check and see how we're doing and where we're at.
And I think also a lot of times you kind of get started and you get a little bit nervous as to what you got into and how you're going to manage these days. Like you're saying, it's a lot less than you realize, but it seems like a lot at first. But then you start to see the progress. You start to see
Right.
your teeth changing shape,
Yeah.
your smile changing shape, and it
Yes.
gets really exciting. And
Yeah.
you start to remember where you're going and what this journey is about. And that you're going to have that beautiful smile at the end, and you're going to have a functional bite that's going to like last your whole life.
Yeah.
So then you kind of get that encouragement to keep going.
Right. So if somebody's on the fence,
Yes.
what would you say to them to help them make the decision whether or not they should potentially do Invisalign?
I would tell them seeing is believing. Come on in and get a scan and see what Invisalign can do for your smile.
Right. Because sometimes you're not realizing, you're just thinking you want to aesthetically fix something, and next thing you know, it's going to fix your bite and change a lot of things and make things more comfortable.
Yeah. Your hygiene appointments more comfortable.
Yep.
Your nightly cleanings more comfortable.
Yep. And the reward is you will have to come and see us less
Yeah.
for all those reasons. All right. Well, thanks everybody for watching us on our first chat session on Invisalign at Fielding Dental Healthcare. That was kind of fun and awkward.
It was fun. It was definitely awkward.
You were more awkward than me.
You were awful. I was great. Let us know if there's any other topics you want us to cover, like Carly's perfect hair. I don't know.
Luckily, we're not a hairdresser. All right.
That's a wrap.